Well, thank you very much for joining us today to talk about IBI's benchmarking program for employers. And the focus is how do we maximize the value of data? It's always one of the things that we hear from our employer members. So let me really set the agenda today. First of all, we'll talk briefly about how the benchmarking program fits into the broader IBI tool set. I want you to have a good overview and background of how this fits into the other measurement and modeling tools that we have available. Secondly, where the data come from. We have amassed a very, very large benchmarking database, and we want you to understand the sources of that information. Third, what the employer gets when they participate in IBI's program. So we'll actually go in and look at an employer report. And next, what you can do with the information. A lot of times people don't feel very comfortable in looking at spreadsheets of numbers. And so we've provided some templates that allow you to tell a story with the data that will come out of the benchmarking reports for employers. Next, some of the pragmatic parts of the program, what it costs, how to get started, how to provide data, and then how to get questions answered if they come up along the way. So with that, let's get started. So how does the benchmarking program fit into the broader tool set of IBI tools? As we work with employers, and as we have worked with employers over the last 4 or 5 years, we have found that as employers move to this broader discussion of health and productivity and disability and absence and the like, they're coming at the conversation from different entry points, probably associated with the jobs they have in their organizations. And one of those entry points is managing absence and lost time. And I think in part because what we've seen in the economy, and certainly we've seen many employers downsize, I think there's a recognition today that having people at work is more critical than it's ever been before. So many employers are coming at this broader discussion from the absence and lost time perspective and moving it back and connecting with their colleagues around health and seeing how it all fits. Secondly, perhaps a more traditional focus for employers is chronic health conditions. Employers have been focused on chronic health conditions. They understand that chronic health probably accounts for 70 to 80% of their health care spend. But what they're asking now is how does chronic health connect to lost time and lost productivity? How do we start to really understand the kinds of chronic health conditions that are important in our organization beyond our health care spend? And how does that relate to productivity? And then finally, the third entry point, and this really is driven by healthcare reform, is really understanding the big picture. We all know that in the next several years, every employer in the U.S. will make a decision to stay in healthcare or walk away, send employees to state exchanges, and wash their hands of it. So how do employers start to see what's at stake and what's at risk with regard to healthcare and all the health dimensions that are associated with the conditions that exist in a workforce? And of course, one of the key factors in all this is, does the employer have data or not? So let me put this in context, the tools relative to the entry point. So when we look at absence, we find that many employers have done a relatively poor job of tracking incidental absence or traditional sick leave. They're realizing that absence is important, but they have no idea that source of absence, how much there is, how much they might pay to their employees in wage replacement payments when they're sick, and how much lost productivity is associated with that lost time. So we've built a model, we call it the Absence Cost Estimator. All our members have access to this model as part of membership, which provides those dimensions to the employer. The amount of lost time, expected wage replacement payments, and the associated lost productivity around that lost time. The second part of our absence work is our benchmarking program. We call it Benefits Intelligence. That's what we're going to talk about today. On the chronic health side, again, those employers that don't have a lot of data and are interested in broadening the picture, the model we've built with Ron Kessler at Harvard Medical School, we call it the Health and Productivity Snapshot. It really connects chronic health conditions and the expected chronic health conditions, given the characteristics of a workforce, to lost time, to performance decrements, and to lost productivity. On the measurement side, Our self-reporting tool, again developed with Ron Kessler, his next generation of his original HPQ, we call it the HPQ Select, which is a tool that we actually use with employers and their employees, a survey tool, or we build the core questions into the employer's HRA to start to get at these broader dimensions around chronic health. And finally, the enterprise. The question of what's at risk around health in our entire business. Our newest tool, the Full Cost Estimator, actually provides employers estimates of their healthcare costs, disability, lost time, workers' comp, incidental absence, performance, and productivity, all in one model. So for the employers that really want to have a conversation both internally and with their partners around what health really means, we can work with them with that model. Okay, let's turn now to the subject of the day, which is benchmarking lost time programs. IBI has been in the enviable position to be able to build the largest benchmarking database in the country that covers both occupational programs and non-occupational programs. Now, where did the data come from? How have we been able to build such a large database? And we've done that by connecting to these 15 IBI member companies that manage claims, either as insurers or third-party administrators. So these 15 companies provide to IBI on an annual basis blinded claims level data, an employer identifier that only the provider of data knows, and the industry information for that employer. And what that allows us to do is roll the claims data up to the employer level, roll the employer data up to the industry, and create very large benchmarking databases for our member companies. And here's what's in the 2010 Claims Experience Database that we'll talk about today, and is the source of our latest work with our members around benchmarking. So as you see at the bottom here, we have data on nearly 48,000 employer programs. And that's really why we created the Data Consortium, because you really can't do good benchmarking with small data sets. Some organizations will provide what they consider industry benchmarks. I'll pull that and put that in quotes, with just 5 or 6 employers in a group. And you just can't do that and be credible. In fact, we created a benchmarking group with at least 30 employers and 2 providers of data, which is why we've been able to build benchmark industry groups for over 750 SIC codes from the 1-digit to the 4-digit level. And this is all based on about 3 million claims in our underlying database. Now, having that claims data allows us to do additional analytical work. Some of you may have seen just yesterday some research that we published looking at trends in claims experience from 2008, 2009, and 2010 from our underlying benchmarking database. Now, what you get as a user, as an employer that participates, and what I'd like to do now is just jump out of the webinar and bring up the sample report, and we'll use short-term disability as an example. Now, this is a report that an employer receives when they participate by providing data to IBI, either directly or with their partners. And the first thing that we see in the benchmarking report is a dashboard. And there are a couple of things I want to emphasize here about this dashboard. First of all, we've tried to bring some experience in the 4 major areas: claims experience, lost work days, payments, and lost productivity. Some real key metrics in each of those areas to give the user an overview of how their company stands in red. So the red is the employer participant and their results, versus 2 comparison groups. Now, this is important, and as we look at the report, we'll illustrate this. We have metrics really calculated at 2 different levels, or 2 different ways, if you will. One is at the employer level. There's some metrics that are best calculated at the employer level, and I think the best example of that is incidence, number of claims per 100 covered lives. That's an employer-level metric. But there are other metrics that probably are best calculated at the claims level. Let's say someone is interested in the average claim costs in an industry, or the average durations. Those are metrics that really are claim-level metrics. And so what we've done here is we've provided metrics at 2 different ways of measuring the employer and the claims, and then allow the user within the report to identify which measure is most useful to suit their needs. So we show here in the dashboard highlights some key metrics showing how the employer compares to their comparison group. We get down in the dashboard highlights to some of the key major diagnostic classifications, again, how the employer's diagnoses compare to those in the industry. We find that there are two key features oftentimes that employers want to look at when they try to understand their experience versus their comparison group. One clearly is plan design in the disability area, and the other is key diagnostic classifications. So that orients the user to some of the highlights, and then we get down into the real guts of the report. And here, the structure of this report, and really the structure of all our benchmarking reports, looks like this. In the left column here, we've organized our metrics around the key questions that are important to employers. So, for example, how often is the program used by employees? Measures of incidence. How severe are the cases? Measures of cost. How much lost work time does the program generate? Obviously, measures of lost work days. And how successful is the company at returning employees to work? So for each of these metrics, we show a variety of different statistics, if you will. The first is always the results from the company participant, your company, shown in green here. So these are the results for the employer that participated in the benchmarking project. But then we show how that employer compares on a variety of different ways. So, for example, we always show the employer versus the group average, or the arithmetic mean. But we want to go beyond that because sometimes the mean value can be deceiving, particularly if you don't have a nice bell-shaped curve in the underlying data. The mean can give you somewhat of a skewed view of what's going on. So we provide other statistics for context. The group median, the 50th percentile, that value that divides the group into two equal parts. And when you have a lot of values on the high end of a distribution or the low end, the median value often is a better measure for what's typical in experience on that particular metric. But again, beyond that, we show the percentiles because we always want to give the user a sense of what the shape of the distribution looks like. Because this allows the user to say, well, here's my result, and just eyeballing it, I can say that 75-80% of the employers have higher values than I have in my group. It's a very useful comparison for employers as they think about where to focus their attention on improvements. In addition, for each metric, we show the number of employers that went into the calculation and the number of claims. These two features are very important because they give the user confidence in the calculation. The more employers and the more claims you have, the more confident you are in getting good comparisons. And then finally, for each of the metrics, we show the median value, that 50th percentile, for all the employers in that benefit program, because we believe that having that broader context is helpful to employers as they think about what other employers are doing. Now, back up to this question of the calculation. This is employer-level experience. So all these are calculated at the employer level. Remember that as we go through. But once we have the overall results, then we provide the user results by plan type. As I said, employers are always interested in plan type. So what we do when we get data from our data consortium companies is for each claim we get information on the elimination period involved and the duration of benefits, the maximum duration of benefits. And from that data, we build a typology of plan types. Here you see plan A through plan I, based on the combination of those two characteristics, elimination period and duration of benefits. So what this allows us to do is provide the user information about what's going on in their industry by way of plan type, because every employer, as they look at making improvements, plan type pops up, and they really like to know what predominates their industry group, what's typical, what employers are doing. And then we also provide for each plan type the results by metric. So for each of the metrics we saw above, we have the median value, the mean value, the number of employers, and the number of claims. And again, showing the company's results. So it now brings the user much more detail about how these metrics play out in the context of different types of plans. So for each of those metrics, we provide the very same information by plan type. And again, we're still at the employer level. But then we also provide the very same information with the claims level of calculation. So as I mentioned, if you're particularly interested in costs and durations of claims, really the claims level experience is where you want to go to and compare how your results are within the context of your industry. But the point here is that we want the user to decide. If the user decides they'd like to see what's typical for employers in the group, they look at employer-level metrics. If they really want to look at the experience across claims, they look at the claims-level metrics. So again, for the claims level, we provide the very same information by plan design. So it really is a very rich source of information for the user from the standpoint of both metrics as well as plan drivers. And finally, in each report, are the results by major diagnostic classification. Again, showing the company by way of closed claims and payments per closed claim, and the industry comparison group, including lost work time. So this really provides the other piece to help our users really understand what's going on in their industry. So every report, and I've used the STD report here as an example, has basically the same structure that you see here. So let's go back up now to our presentation and now talk about what you can do with it. As I mentioned earlier, oftentimes people don't feel comfortable in trying to look at a spreadsheet of numbers and make interpretations and then build the story, because what this is really useful for is building a story about what's going on in the various parts of a program. So what we've done here is we've provided some graphics as templates, and anyone on the call who would like a copy of the presentation, be happy to send that to you. You can copy the templates and then use those yourselves in preparing any presentations from the benchmarking data. So let's look at this from the employer that participated. And let's start with claims incidence. Now, this graphic is pretty straightforward, but it has a lot of information on it. And let me go through that with you very briefly. So here we see the results of this particular employer. So for this case, this employer had an incidence of 4.4 claims per 100 covered lives. And if we graph that, we see that that is right there, 4.4 on the y-axis, showing the number of claims. But we also show on the horizontal axis where it fits in the percentiles. So here we see the 25th percentile is 5.5, 4.4 is below that, and if we did some interpolation, we'd probably see that this is probably about the 20th percentile. And of course, what that means is that 80% of the employers in the comparison group have a higher incidence than this employer, a very useful piece of information beyond simply the mean. But let's look at that mean or group average, 8.5. So this employer is doing very well relative to the mean incidence in the group. And we show where that fits in the distribution as well. So a slide that is this simple has a tremendous amount of usable information about how this employer compares not only to the average, but where the employer fits relative to the distribution of all the other employers in the group. So this employer is doing quite well from the standpoint of incidence. Now let's look at the lost work days. Very similar structure. This employer's results about 37 and a half lost work days per closed claim. Again, we show where it fits in the distribution of the percentile. So again, doing very well, well below the median value. And as we show here, also well below the average value of 52.5, and we show where that fits in the distribution as well. So again, this employer doing very well on incidence and doing quite well on lost work days. A little easier to pick up perhaps than if the user was simply looking at that spreadsheet I showed you in the report. Now let's look at payments, closed claims first. Now we begin to see a very different picture. Again, the company shown in yellow. Now this company is very high and actually beyond the 90th percentile in their closed claim payments, and quite high relative to the average in the group. And then finally look at claims payments by active claim. That is, claims that were active during the year and not yet closed. And this represents all payments to the point at the end of the year. Again, we see a very similar picture. We see the company with quite high claims payments relative to the group average and quite high claims payments relative to the percentiles. So what does this tell us? What are some conclusions from this very brief set of graphs? Well, as we said, this employer has relatively low claims incidence, has relatively short claims durations. Really good news. But we also find that this employer has comparatively high claims payments. So the question that one would ask from this information, it is, first of all, what's the average wage and wage replacement structure in the plan design? This may be a workforce of very well-paid people, and that when they're on disability, their payments are high because of their wage. It also may be this employer has a plan design that is very rich and pays people a very large percent of their wages when they're on disability. But looking at this, these exhibits really get you to some very specific questions that you might want to ask if you're an employer. Now, as we move beyond the employer and look at the industry, we find that oftentimes our members, our users, are very interested in exhibits that focus on what's going on in my industry. So let's rely on the same information from the spreadsheet to look at plan type. And we show here the different plan types that you saw in the spreadsheet. And what, of course, jumps out is there are two plan types that really dominate this industry group. 1 week elimination period and a year maximum duration of benefits, and 1 week elimination period and 6 months of benefits. Now, the reason that these all add up to more than 100% is that most, if not many employers have more than one plan type in their organization. And so what this really says is that for all the employers in the group, 59% have that plan. For all the employers in the group, 47% have that plan, which means that employers have more than one plan. But it's a very quick way to visually interpret what kinds of plans might exist in an industry. And as we look at diagnoses, we're always interested in Pareto groups, a relatively small share of claims that drive a large share of costs. So here's an exhibit, again, from the report, showing the percent of claims in the dark orange and the percent of costs in the light orange. Well, of course, what jumps out at you is that for musculoskeletal conditions, we have costs disproportionately large relative to claims. And again, it allows visual inspection and a real focus on what may be important and what you may want to look at in your own organizations or with clients. A simple pie chart on the kinds of conditions. We see here musculoskeletal, a big share of these conditions relative to others. And finally, diagnosis by lost time. So again, taking the key MDCs and portraying the average number of days of lost time by diagnosis. So that spreadsheet of numbers you saw can really drive some very interesting and very important discussions by using these kinds of graphs. And as I said, be happy to provide these as a template, and then you can use these, and this perhaps will give you some ideas about other visual representations that might be helpful in telling your story as you talk about what's going on and where you want to focus your efforts. Now, what's the program cost? The program has a $500 flat fee per employer. Previous to this, we used to price this with a fee per program. We charged $350 per program, so that if an employer participated in all 4 programs, it was a charge of $1,400. Well, we really evaluated what our basic purpose of this is, and our purpose, of course, is to get this kind of information into the hands of employers and try not to put significant financial barriers between employers and getting access to good data. The other key feature here is that each employer that participates gets all 4 reports, all 4 benefit program reports, STD, LTD, family medical leave, and workers' comp, even if they don't give us information from their own experience for those programs. Now, why do we do that? Well, we believe that this issue of absence and disability and lost time is critical for employers going forward. And by providing these reports to the employer, they then have at least industry information to share with their colleagues internally, to discuss internally, to talk about a broader view of absence and how it all fits together. Oftentimes, employers will see that lost time in workers' comp is dramatically different than an STD. We did research probably 12 or 13 years ago comparing return-to-work programs for occupational and non-occupational conditions. So we always want to bring this information across all programs to our participants. All reports are confidential. We don't share a report without permission of the employer. We certainly don't sell reports, but it really allows us to maximize, again, the value of the data that we have built in the benchmarking program. Getting started, the registration to start the process is online. And let me just go to this link. Or you can actually go to the website and sign up there directly on the website. So we wanted to make this as simple and straightforward as possible. And so the online registration, we get some basic contact information from the company. We find out if a partner will be providing the data on behalf of the employer, contact information there, asking how many copies of the various reports the employer wants, and then we pick up information in the registration around some characteristics of the company and industry. We use this information in our loss productivity analysis and calculations. And then finally, if the machine doesn't freeze here, we're going to go on to the final set, if we can. There's only one more. There we go. Took a little while to get out of that. Let me just go through this quickly to the final slide here, which is providing data. And we have also provided online data submission. So you can register online. You can actually submit data online. And let's see if the site will cooperate and take us there. If it doesn't, it's okay. We try to make it very straightforward for our members to provide us data and register. So in the old days, we would have Excel spreadsheets that the employer filled out and sent to us. Now we provide everything electronically online. Again, the company and contact information, if there will be a partner providing data, and then starting to get into the actual data delivery. So as you can see here, when we work with employers, we get aggregate or summary level data, number of claims, active, closed, lost days, payments, and the like. And for those employers that actually do have diagnostic information, we pick that up as well here so we can give them back those comparisons. So you see the data collection is quite straightforward. Oftentimes, as I mentioned, an employer's partner, as an administrator, provide this data. We can arrange for that as well, but it really allows a very efficient way to provide data and certainly an efficient way for us to process data as well. And then finally, if anyone has questions about registering or questions along the way, you can contact Skylar at sperry@ibiweb.org or the phone number 415-222-7266.